Welcome back to the show. Today we're digging into a question a lot of you keep asking, and it sounds simple on the surface. Do GLP-1 medications actually work? And honestly, what does the word work even mean when it comes to weight? Before we get into it, a quick word from our sponsor. This episode is brought to you by Telehealth FX, a platform where you can explore your options and get connected with licensed clinicians over at telehealthfx.com. That's telehealthfx.com. We'll circle back to them. And one important thing right up top. Everything we talk about today is general education, not medical advice. Please talk to your own clinician before starting or stopping any medication.
Absolutely. So let's set the table. GLP-1s, that's the class that includes Semaglutide and Tirzepatide, are medications that mimic a gut hormone your body already makes after you eat. In plain terms, they slow down how fast your stomach empties, and they turn down the appetite signals in your brain. You feel full sooner, and you stay full longer. That's the basic engine.
And the reason everyone's talking about them is that the trial data is, frankly, striking. In the big Semaglutide study published in the New England Journal of Medicine, adults lost on average about 15% of their body weight over roughly 68 weeks. Around 70% of people in that trial lost at least 10%.
And Tirzepatide, which hits 2 hormone receptors instead of 1, pushed even higher in its trials, somewhere between 16 and 22% depending on the dose. In the first head-to-head study, Tirzepatide came out ahead of Semaglutide on average. But here's what I always want to underline. Those are averages across thousands of people. Individual results vary a lot. The average is not a promise about what any single person is going to see.
That distinction matters so much. And there's fresh news here too. Earlier this year, the FDA approved the first GLP-1 in pill form for weight management that you can take any time of day, no food or water rules. In its trial, the highest dose led to about 12% weight loss over 72 weeks. So the menu is genuinely expanding beyond injections.
Which is exciting for people who really don't want a needle. Quick note on who these are even studied in, though. The trials are in adults with obesity or who are overweight with a related health condition. This isn't meant for shaving off a few vanity pounds, and eligibility is an individual call.
Good time to pause and hear from our sponsor again. If you're curious whether something like this could fit your situation, you can learn more and see if you may qualify at telehealthfx.com. That's telehealthfx.com. And here's the honest disclosure on that. Telehealth FX is an informational and affiliate platform. It is not a medical provider, and it's not a pharmacy, and it may earn a commission. The actual care comes from licensed clinicians, not from the platform itself.
Thank you for saying that plainly. Okay, now the part I think nobody talks about enough. What does effective really mean over the long haul? Because these medications work while you take them. In the follow-up studies, when people stopped, they regained roughly 2/3 of the weight they'd lost within about a year.
That's a huge deal. So it's not a course you finish and you're done.
Right. Clinicians increasingly treat obesity as a chronic condition, and the medication has ongoing management, paired with real nutrition, enough protein, and strength work to protect your muscle. The medicine is a tool, not the whole toolbox.
And effectiveness isn't only about the number on the scale either, is it?
No, and this is one of the most interesting findings. A large study called SELECT looked at people with excess weight and existing heart disease, but no diabetes. Semaglutide cut the risk of major cardiovascular events, things like heart attack and stroke, by about 20% compared to placebo. And intriguingly, that benefit looked partly independent of how much weight people actually lost. So some of the effect may go beyond just slimming down.
That's the upside, told straight. Now let's be just as honest about the trade-offs, because no medication is free of them.
The most common side effects are gastrointestinal. Nausea, vomiting, diarrhea, constipation, usually early on, and they often ease over time, but they're real, and some people do stop because of them. On the more serious side, there's a boxed warning about a risk of thyroid C-cell tumors, and these drugs are not for anyone with a personal or family history of medullary thyroid cancer or the genetic condition MEN2. There's also a risk of pancreatitis and gallbladder problems, and researchers are still studying a possible link to certain eye conditions. None of that is a reason to panic. It's a reason to be properly evaluated by a clinician who knows your history.
And one more thing people get genuinely confused about. You'll see compounded versions advertised all over the place online. Those compounded Semaglutide and Tirzepatide products are not FDA approved. The FDA does not review them for safety, effectiveness, or quality. And they are not the same as the branded Ozempic, Wegovy, Mounjaro, or Zepbound that were actually studied in the trials we just walked through. That's a conversation to have openly with a licensed clinician.
Well said. So, do they work? The evidence says yes, meaningfully for a lot of people, but it's individual, it's ongoing, and it works best alongside real lifestyle change.
That's the note to end on. If you want to dig deeper or see if you may qualify, you can visit telehealthfx.com. That's TELEHealthFX.com. But more than anything, do your homework and talk with your own clinician about what's actually right for you. Individual results vary, and the best plan is the one built around you. Thanks for listening, and we'll catch you next time.